listening to the Pharmacy Podcast Network.
Welcome to the CRX Podcast, where cannabis and pharmacy merge, unveiling medical wonders and the world of cannabis legalization. Explore the cutting edge, empower your knowledge, and embrace the future of medicine.
Hello, everybody. This is Joseph Friedman, pharmacist with the Pharmacy Podcast Network, and we're doing a special podcast today with some experts. One is a PharmD, the other, Lisa, is very involved in the psychedelic industry as well as the cannabis industry. I'm very involved in the cannabis industry as well as dipping my toe in the psychedelic industry right now. But at the same time, I just want to go ahead and pass the baton over to Regina. Why don't you introduce yourself?
Hi, Joseph. Thanks for having me today. I'm Dr. Regina Moore. I'm a pharmacist based out on the Oregon coast. I'm not practicing much these days, mostly retired from my community pharmacy practice, but I'm a co-founder of the Psychedelic Pharmacists Association and sit on the board of directors and am involved in a lot of legislative and advocacy efforts locally here in Oregon and then more broadly around the U.S. So excited to see where we go today.
Thank you. And Lisa, go ahead.
Hi, I'm Lisa Solomon, and I've been involved in the cannabis education and advocacy space since 2017. In the last couple of years, I've been diving more into the psychedelic space in terms of learning myself and involved in education and advocacy work in the community. I am the Community Engagement Director for the Illinois Psychedelic Society and co-chair of the Clinical Education Council for the Society. And I'm in the process of forming the Illinois chapter of the Psychedelic Medicine Association, which will be the first state chapter. And we are very excited to be a part of that.
Great. And I know, Regina, and you were probably there, there was recently a meeting in Denver of the Pharmacists Psychedelic Association. I think they had a booth there. And one thing that I thought was very interesting was something that I read on how a couple of board members of the Psychedelic Pharmacists Association met with two officials from SAMHSA, which is Substance Abuse and Mental Health Services Administration. Now, my experience with SAMHSA from the cannabis industry is a lot of misinformation comes out from this organization as well as other government organizations. So what is your experience with SAMHSA and the meeting in Denver?
Yeah, we were really excited. There's obviously some things starting to go on behind the scenes as the federal government, recognizes the movement being made with more state-based legalization and other mechanisms for access to psychedelics, and they're paying attention. So the Psychedelic Pharmacists Association was invited to come in and meet with some of these partners, and we had some follow-up meetings with them. Unfortunately, I got sick at the conference. So we're talking about the MAP Psychedelic Science Conference that Lisa was at. Also, this like 12,000 person conference covering the whole psychedelic ecosystem, really, that was in Denver in June 2023. And so I didn't actually get to attend the meeting directly itself, but I did get to talk to some of those government partners a little bit before this private meeting. And it sounds like, they're wanting evidence-based information. They're wanting other stakeholders who come from trustworthy sources, and they're trying to make policies that make sense, or at least start to outline the foundations of doing that. So I appreciate that they showed up there and that they were looking for organizations like mine to try to get some of that information. Beyond that, I really can't say. And I'm just hoping the things that start to come out of this are moving in a more positive direction than some of the history has been with cannabis.
Great. And then Lisa, when we talk about psychedelics, can you sort of get into what kind of molecules are involved, and where there's harm reduction and where there's opportunity for mental health issues and so forth?
Sure. So I'll go over and I'll name some of the commonly used psychedelics. LSD, psilocybin, which is the hallucinogenic ingredient in magic mushrooms, MDMA, DMT, which is found in ayahuasca, ibogaine. There's 5-MeO-DMT, which is found in the bufo toad. There's combo, which comes from an Amazonian frog. Those are some of the ones that are used. Ketamine is the only one that is currently federally legal in the US. Psilocybin has been legalized in Oregon, and we can look to Regina to talk a little bit more about that, and in Colorado. And there are a number of states that have bills that they are working on, hoping to pass. In Illinois, we have HB1, which is also referred to as the Illinois Cure Act, which will decriminalize psilocybin and legalize it for medicinal and research purposes. So that is something that we are working on now, and that's why the Illinois Psychedelic Society is involved in so many education efforts. We know that education is the key to legalization. There is a considerable amount of science and research on psychedelic medicines, though we still need a lot more. There have been a lot of early studies done to show promise in treating so many types of conditions.
Great. And then, so let me ask you this question. Are we going to have like mushroom stores on every corner, in popular areas, Regina, or what's happening in Oregon and how is this being rolled out?
Right. So that is, well, ironically, we did have a mushroom store for a few months, but that was not at all legal. So the model here in Oregon currently is what I like to call an adult supervised use model. So there are regulated access points. You have licensed facilitators who have gone through a training program and become licensed. You have licensed service centers, which are the places where people can take psilocybin with the facilitator. You have licensed growers, you have licensed laboratories, somewhat like you would with the cannabis ecosystem, where they're checking for the strength and verifying that it's the right product. And those all come together for what we call Oregon Psilocybin Services. Adults are able to come and use psilocybin here without a diagnosis. They don't need a medical indication to be able to do it. They can be somebody who's pursuing it for their potential medical benefits, but it's not considered a medical treatment in any way. The facilitators are all under the same license, regardless of if they are somebody from the community who goes through this training, or if they are a therapist or a medical doctor. And it's interesting compared to some of the other things going on in other states, because Colorado's pretty wide open as well. But a lot of them are approaching this more at first from the medical lens, and then may roll out more of a recreational system. We've just moved forward with a single system here for now in Oregon. That being said, we don't know really how many people are going to be able to access it in the first few years, because given all of those pieces, it's going to be pretty expensive. So most cases, probably about $3,000 per treatment, versus like a retail shop where you can walk up and go purchase mushrooms and take them home. But they did try it. Somebody ran for a few months with a place called the Shroom House in Portland before they got shut down. So I expect we'll see some more things like that going on, and we'll see if that pushes the envelope at all and moves towards having those access points, but not currently.
Now, Regina, you mentioned that ketamine is out there and it's legal from federal government standards. But how does and maybe Lisa, you want to chime in here too? Is ketamine, how does that differentiate from psychedelics? And what kind of ketamine is used, and what kind of clinics are using it? What is the route of administration?
I'll just jump in quickly to say that ketamine is thought of as being a psychedelic medicine by some, and others say it is not. It is technically a dissociative anesthetic, and it is administered in different forms. There is IV, IM, there are lozenges, and there's a nasal spray, Spravato. And it is found in all different types of settings. There are people that have opened up clinics for ketamine where they focus on that. And there are a lot of people that believe that it's most effective when it is combined with therapies. They call it KAT, ketamine-assisted therapy. And some large hospitals even have clinics, but they use Spravato, the nasal spray, as far as I understand.
And so what are we using this for? What type of conditions?
Well, the approved off-label use is limited. And Regina, chime in if I'm missing some here, but treatment-resistant depression, PTSD, and chronic pain disorders.
Those are, the basic things that ketamine is covering. And a lot of people say that they have significant improvements with it. So it's got a robust backing from community on that. Some people do it with more of that in-depth therapy, like Lisa mentioned, the ketamine-assisted therapy. There are also quite a few companies that have come up and really grown during the pandemic that are doing more at-home treatment systems. Those are typically with the lozenges where they mail them out to people and they have a check-in system with a nurse or something similar to follow up and hopefully, but not always, have more of that therapy component where they can talk about things in process. How that at-home treatment model keeps going on remains to be seen as changes on how we're able to do mail order controlled substances and things like that adjust coming out of the pandemic. But it's a very popular treatment model, and we saw a lot of providers actually at that MAPS conference in Denver. I think there was a pretty good show of the ketamine crowd. Because it doesn't fall under that classical psychedelic model like LSD or psilocybin, where it's, causing, vivid hallucinations or changes in that kind of perception. A lot of people, like Lisa said, don't consider it to be a psychedelic, but at these higher doses, when people, come back to their baseline, many of them do compare it to the level of experience that they have with the traditional psychedelics. They're just not like awake. They're not experiencing it in the same capacity.
Okay.
Right.
Yeah,
And the at-home model is somewhat controversial. There are people that feel it is phenomenal because it gives access to a lot of people that don't live in an area where they can access IV or IM ketamine. And it is also much lower in cost. So some of the safeguards that are used by the better at-home ketamine companies include a blood pressure cuff, having someone monitor you while you are on it, or making sure you have someone at home that can call 911 if you have an issue, because with ketamine, it can elevate your blood pressure. So people that have health issues that can be aggravated by that need to be very careful. Glaucoma, high blood pressure, and that's where you really need the advice of a medical professional to make sure that you are a candidate for that.
Great. And, one of the things that, I don't know if, Regina, you have this in your area, but Lisa and I are members of what we call Chicago Med Psychedelics. And it's a group of healthcare professionals, physicians, PhDs, advanced degree nurses. I'm the pharmacist in the group. And what we do is we meet once a month at this very eclectic coffee house. It's actually owned by Billy Corgan, from the Smashing Pumpkins, the frontman of Smashing Pumpkins. So a freelance writer out of New Zealand, Emma Stone. Is it Emma Stone? Yeah, Emma Stone wrote an article, and it was picked up by High Times Magazine, about this group and what we do and how we exchange information about meetings and events and things like that. Is there anything like that going on in Oregon?
There are various groups. There's like the Portland Psychedelic Society, and they have, I think it's monthly, like a healthcare provider meetup that was occurring on Zoom last I had checked, which is nice because that allows more people throughout the state, like me, who's about 3 hours from Portland, to attend sometimes. But it's under the umbrella of Portland Psychedelic Society, and I think there's quite a few little groups starting to pop up now that our psilocybin program comes on board, but they still seem to be fairly little small niches rather than a larger organization. So we'll see if something like that develops.
Okay, and how is it dosed? I know we talk about hero doses, we talk about micro dosing. If you're a pharmacist in the audience and you wonder, okay, I'm used to being in the pharmacy and having all of these pharmaceuticals in 1 milligram, 5 milligram, 10 milligram, half a milligram. How is psilocybin dosed?
So that's somewhat complicated question, because if we're talking about how it's referred to more widely, like in the common use culture, versus how they're talking about it in clinical trials, or how the Oregon system is looking at it, it's different. Traditionally, it's been people taking raw mushrooms, where it's only a percentage of the mushroom that has any active component, and then we're usually referring to grams or sometimes milligrams if people are microdosing. And then in the clinical trials, or now that we're testing for potency and looking at standardized dosing, then it's typically more in the lower milligram doses. So I think that's important to be aware of if you're going to have any conversations with people, and knowing which audience you're speaking to. So in the traditional dosing, we're usually talking for a more active trip, so to speak, where people are experiencing things and having some of those perceptual alterations. You're 1 gram plus, probably more like 2 grams plus. That being said, potency varies quite a bit, so you don't really know what you're getting unless you're testing. And then for the more clinical model, they're looking at things more like 25 milligrams or so for the higher doses. I honestly would have to look up what that translates to for a microdose in the milligram side, because that hasn't really been looked at that much, though the Oregon system is allowing for it. But if we're talking about somebody taking raw mushrooms and doing microdosing, then it's typically like under a half gram, and then it's down significantly from there, down to maybe like 100 milligrams or something like that.
Okay, and one of the things that always comes up, and I saw this coming up quite a bit, in the cannabis industry, is contraindications. So in other words, like if someone has like the genetic background of having psychosis in their family, cannabis might not be the best option for them. What kind of contraindications or drug interactions can we expect with psilocybin?
This is another one where the research is evolving quite a bit. I won't speak firmly to many of these things, but at least in this Oregon system, the only direct contraindication is, I think it might only be in the last month, but like basically recent use of lithium, and that's more to do with the types of reasons that lithium is used for, schizoaffective disorders or bipolar disorders, or things that there's a concern that a psychedelic experience might precipitate another episode. So those people are supposed to speak to their healthcare providers. On a more subtle level, there have been a lot of questions about how other psychoactive medications and or medications for depression can affect the experience. There was a new study that came out, I think, just last week, as part of the Compass psilocybin drug development trials, that was looking at the effects of SSRIs on dosing. I haven't delved into that one too deep, but a lot lot of the information keeps pointing to that SSRIs may not really impact the experience. And we used to think that because of that interplay with serotonin, that it would blunt the experience, or people would need to wean off of antidepressants, or that maybe they would need higher doses. So a lot of the things that we thought based on just kind of, pharmacology information, and they may not fully hold up, but some of that I think also speaks to the fact that we may not fully understand yet all of the things that are happening when someone is having a psychedelic experience and how that fully plays into the clinical benefits that we see as far as helping with depression and those types of things.
Yeah, it's interesting. Within our group, Chicago Med Psychedelics, we do have one physician, Carolina Mikos, and she left her primary practice. And what she does specifically now is she goes to a patient's home where they source the product, and she is with them, holding their hand and being support for their experience with psychedelics. That's sort of a pre-legalization idea that this one doctor has to be there for patients that are going through this type of therapy. And the idea is if you're a pharmacist out there, and you've got patients that are on chemotherapy, they've got end stage, cancer prognosis, things like that. One of the things that I've learned is that sometimes a dose of psilocybin can really change their thought process and make them more accepting of what's going on in their life. I mean, have you had any experiences with that, Lisa or Regina?
Go ahead, Lisa.
Well, I've heard a number of people talk about the benefits of psychedelics for palliative care, that people who are nearing the end of their life after a psychedelic experience exhibit much lower anxiety, and they tend to be more at peace with what is coming. And some people believe that is because they are getting into this space of like universal love. They feel like there is more, that they're not just meeting this like horrible end. Sue Sicily, who was a cannabis researcher for many years, has done some research on psilocybin for end of life and is a big advocate for that.
And how does that differ from, say, ecstasy, MDMA, where they coin that the love drug, and that gives everyone sort of a great, outlook as far as being loved and loving everybody else?
I haven't looked at research on that, but I will say that psilocybin and even ketamine, if it's used for this, can be a gentler experience.
Interesting. Regina, what do you think?
Well, I'm not aware specifically of any research looking at MDMA in that kind of palliative care realm, so I can't speak to it from that level. But there is a pretty robust body of research on psilocybin. Dr. Roland Griffiths is another one, if people are looking for somebody to read up on or find some of his papers, who's talked about this a lot. I think one of the benefits of psilocybin versus MDMA, potentially for end-of-life care, is that psilocybin is generally considered to be pretty safe, and most people seem to be able to tolerate it fairly well, physiologically at least, especially with the proper supports around. MDMA, can increase blood pressure more, and can have, people need to make sure that they're staying well hydrated, and potential for electrolyte issues. Usually we consider that more in like a rave situation where people are also exerting a lot of energy and sweating and whatnot. But somebody who's more labile, or body isn't functioning as well, or something closer to end of life, there may be more considerations in how something like MDMA affects them, and if it's safe to use at all. Whereas psilocybin, most of them seem to be able to do it. So, and then I think MDMA, we're talking more about that, especially as it potentially comes onto the market as a prescription, as a psychotherapeutic aid. So a lot of people will talk about MDMA being something that opens people up to be able to like move past, weeks or months of the therapy process to feel comfortable exploring some of those deeper things. Whereas some people talk about psilocybin as the experience in and of itself can be therapeutic and help them maybe come to terms with things, especially if they are going into the experience with a goal of, saying, I'm trying to come to terms with the end of life or family issues or things like that. If they go into it with a goal, that they may be able to come out of just one session feeling more relief, whereas the MDMA process seems to be more of an ongoing therapeutic effort over multiple sessions that may not lend itself as well to someone who's in a hospice situation or something like that.
Well, that's very interesting to know. And what do we know about, the idea of using psilocybin for smoking cessation, getting off of alcohol, getting off of substances, for PTSD, things like that. Lisa or Regina, wherever you feel like you want to chime in, go ahead.
Well, there has been a lot of research coming out about the use of psychedelics to end addiction. And what's very interesting is, unlike 12-step programs where you are never to touch the substance, they are finding at these treatment centers that after undergoing successful psychedelic therapies for the addictions, that it changes someone's relationship with the substance. They have people that were alcoholics, and they find that after this, they can have an occasional drink. They don't feel a compulsion to continue drinking, to have the next one and the next one. What they are also finding is that for some people, they're seeing this benefit can last up to 2 years. Some people they're finding need a tune-up, another treatment after 6 months. So this is an area where they are trying to focus a lot of research. It's life-changing for people to be able to feel free of that and not feel like they're a slave to that addiction, that they're always fighting it, but to allow people to come out on the other side of it. And this is with a number of different substances, whether it's ketamine, psilocybin, ibogaine. And a lot of people do leave the country to do it because some of these substances and some of the treatments are not legal in the US. And that's something that's very important to think about harm reduction in terms of going to these treatment centers. You need to make sure that they have medical staff that is going to make sure the dose you're getting is appropriate for you, that you're not having an irregular heartbeat when you're going to do these. And it will be nice when these are legalized in the US and they become more affordable and therefore more available to greater numbers of people.
And then you said something very important, Lisa, and that is the idea that you take a Joe Average on the street who's got depression or is end of life or has PTSD or some kind of substance abuse issue. You just don't want them going to anyone that can produce magic mushrooms or psilocybin or ketamine and to say, hey, treat me. You really want to have a knowledgeable healthcare professional that's behind all that.
Well, I think it's important when we're talking about these things too to kind of be aware of the various reasons that people use these substances and who the proper support team would be to help them meet their goals. Because of the way that the language has evolved over the last decade or so, especially after Michael Pollan's book, How to Change Your Mind, that a lot of people read, we've really come to talk about this in terms of, saying psychedelics as medicine, which they definitely can be, and then looking at the potential clinical outcomes that people can have. If somebody has a significant, clinical disease level, treatment-resistant depression, a significant PTSD, where they should already be getting the support of a therapy team and things like that, then yes, those people likely should be pursuing that avenue. But a lot of people report benefits with without those things. There's lots of people who are self-treating. And then, this is kind of my little soapbox that I get on a lot that I like to bring up as a healthcare professional. Is also, I think there's value in recreation in some ways. If you can find a safe way to do it, if you know that your body is safe to do it, if you're doing it with kind of those proper guardrails, finding time for rest and relaxation and reconnection and novel experiences can probably help support our mental health. So which is one of the reasons I'm excited about our Oregon system, because it doesn't say you have to use this for a certain reason. So I think it's important knowing what your goals are, knowing what the general health of an individual is, and then if they have concerns, making sure they follow up with a healthcare provider. But there are potential benefits that people can receive outside of a traditional healthcare setting, and we just need to continue to dial things in and make sure that the right clients or the right patients are going to the right places to receive services. And I think that's important to point out if we want this to be something that's accessible. Because if everything's going to be under a psychedelic assisted therapy model, for example, that means you have clinician time as well as, drug costs. And that's going to make treatments very expensive. I would expect when these do become prescription, because MDMA and psilocybin are both likely to hit the market by the end of the decade, they're both going to be things right now that are, because of the time involved, are going to require prior authorizations. Probably people who are going to have to demonstrate that they failed multiple, cheaper, quicker type of options. So just keeping in mind who the target is and what the appropriate guardrails are for them.
Regina, you raised an excellent point with the recreational part of it. So we know a lot of people consume alcohol, which we know has a lot of negative effects on the body. And some of these psychedelic substances, when used in the appropriate dose, if you know you're getting a clean and safe product, can really help, be a mood elevator, help give you energy. And there are a lot of people, especially people in their 20s, that have stopped drinking and take like a mini dose of psilocybin when they go out, and they feel much better. They have no hangover the next day. They feel more in control of themselves than if they've indulged in alcohol. So that is a great point. And as these programs in the states move forward, that is something that we'd like to see them allow for.
And, I totally agree with both of you. I think, when I'm talking about the cannabis industry, I'm looking at, okay, if you're a patient, you really want to talk to a healthcare professional who has in-depth knowledge of drug interactions and modes of therapy and routes of administration and dosing and all that. Now, if you just want to walk into a dispensary and get the highest THC product just for recreational use, well, there's that. Especially if you're not a patient, you don't need to talk to that healthcare professional. And it sounds like the same thing is true with psilocybin and ketamine and things like that. But psilocybin and ketamine, you're not going to walk into a store and talk to someone who's undereducated and get that product.
I would say that what I described before applies mostly to psilocybin and potentially to something like LSD. There's a great chart out from Professor David Nutt out of the UK, and we've seen this replicated multiple times, that looks at the potential harms of various substances, from alcohol to methamphetamine, psilocybin, cannabis, etc. And it looks at the potential harms to the user and also the potential harm to others, which is an interesting element to add in. And we find that the classical psychedelics, LSD, psilocybin, are very, very low on that risk scale compared to some other things. So maybe just use that as a guide if someone's trying to kind of assess where it may be safer for people to look into things on their own. Ketamine, and in particular ibogaine, I think are two that I would say probably need some input from a healthcare provider because of some of the safety considerations.
Excellent points. And, I think we can go ahead, and looks like we're running a little short of time here, but I just wanted to see if you have any, final thoughts or how people can get a hold of you. So Lisa, why don't you go first?
Well, I do want to add in that while we've talked a lot about the use of psychedelics for medicines and psychedelic assisted therapies, it's important to recognize, respect, and protect the indigenous and ceremonial use of these substances. Many of these have been used for thousands of years and continue to be used in ceremony. If someone wants to reach me, they can reach me at lisa@IllinoisPsychedelicsociety.org.
Great. Regina.
Let's see. Final thoughts. I think just as psychedelics should help to do in opening our minds a little bit, keep an open mind as this continues to roll out. We have a lot of misinformation built up over the last 50, 60 years with the drug war, a lot of rethinking to do. And I hope that we just consider to look at these things under a lens of empowering individuals to have the most benefit in their lives that they can, and to be able to do that safely. And that can look different ways. You can find me at reginamore.me is my website, I guess, short one. And also PharmS, PHARMS, connect@gmail.com.
Excellent. And, I think, Regina, to your point, the misinformation, I think if we can get the federal government out of the way and their misinformation machine, I've experienced that with cannabis. Hopefully we're not going to experience the same thing. I know back in the day, Timothy Leary, went out there on a limb and I think gave, psychedelics a bad name back in the day. And I think that catalyzed the whole, the whole government anti-psychedelic revolution that brings us to today, where now they're looking at this as a benefit. And, and I don't think we want to minimize the harm, but we also want to understand where people can really get a lot of good use out of this, and it can really help a lot of people with mental disorders and so forth. So with all that said, this is Joseph Friedman with the Pharmacy Podcast Network. Thank you for listening, and thank you, Lisa. Thank you, Regina. This has been a great conversation.
Thank you, Joseph.
Thank you.